And now that I've got all the right buttons pushed, we'll get started here. We'll start with Mayor Brown.
Thank you, John. Today's Grand Forks Mutual Virtual News Conference, Tuesday, May 21st, 2020, includes Dr. Josh Deere with All True Health System, Dr. Terry Brenner, Superintendent of Grand Forks Public Schools, Wendy Wendt, Director of Grand Forks Public, and on our question and answer panel, we'll be having Todd Phelan, City Administrator, and Debbie Swanson, Director of Grand Forks Public Health. So I want to thank you all for tuning in today and staying informed. The North Dakota Department of Health and private labs are reporting 29 tests completed today for COVID-19, with one new positive case in Grand Forks County. This brings the total positive cases in Grand Forks County to 320. State and private labs have reported 215 Grand Forks County residents have recovered, and 1 and 2 are still active and being monitored. Sadly, 3 individuals have died with COVID-19 in Grand Forks County. We've been seeing the positive results of our contact tracing efforts of late, with limited secondary and tertiary spread of the cases and an overall reduction in the number of new cases in Grand Forks County. Really effective contact tracing efforts and cooperative individuals and businesses have been keys to Grand Forks being able to slow the spread. In fact, the prioritization of public health and remaining cautious has been the hallmark of our Grand Forks businesses in the initial steps of our GF Smart restart. However, we must not let our guard down. North Dakota has set records for the number of confirmed positive cases reported both yesterday and today. We know just how fast things can change and how volatile this situation is. Everyone needs to continue to take responsibility for the health and safety of themselves and their neighbors by remaining vigilant and cautious, and continue to follow the guidelines and recommendations from the CDC and the state of North Dakota. Thank you to the residents of Grand Forks and business owners for taking the health and safety of our community seriously and for doing your part for a GF Smart restart. Consumer confidence is the key, and the market will drive success. We will focus on the remaining smart and safe issues we have. We need to be respectful of others and their safety while in public settings, at the store, and supporting local businesses. Abide by the physical distancing standards, wear a face covering, and help slow the spread. If we continue to focus on being smart and safe, we will be successful in our GF Smart restart. This afternoon, I met with my Economic Response Advisory Group, and the pandemic's impact on current and future housing in Grand Forks was a major topic of discussion. COVID-19 and the difficult economic climate we will find ourselves in will surely have negative impacts on housing in the future. I'm creating a diverse task force to do research, investigate, and provide recommendations to myself and the City Council regarding COVID-19 current and future impacts on housing in Grand Forks. City Council President Dana Sandy has agreed to chair this task force. I'm anticipating full membership of this task force to announce at the June 1st City Council meeting. What is this pandemic currently doing to the housing market? Can we anticipate what the needs in the future will be? How can we be proactive in addressing these challenges early on? These are the questions this group will be tasked with answering and providing recommendations to address. Finally, starting next week, we'll be reducing the frequency of these press conferences to once a week, with additional briefings as needed and appropriate. These will take place on Thursdays at our normal time of 2:15. And with that, next will be Dr. Deere from All True Health System. We want to give a special thank you to Dr. Deere, Dr. Weiser, and All True Health System for being accessible to the public, as they have throughout these press conferences. They have been such a great institutional partner that provides an essential service, not just for the city of Grand Forks, but the entire northeastern quadrant of North Dakota and parts of western Minnesota. They've done a tremendous job over the past couple of months in response to this pandemic, and we anticipate all the work done by the doctors and nurses on the front lines will continue. Dr. Deere?
Thank you again, Mayor, for this opportunity to connect with our local media. As we progress in our experience with COVID in our community, we're seeing those who have been diagnosed come full circle with the virus. While sadly, 2 of our All True patients have passed away from COVID, we also are seeing some hope at the end of the tunnel. As of this morning, we have 1 inpatient with COVID at All True. To date, we have discharged 25 patients successfully. Across the community, many more have recovered from the virus. While the fight is not over, the others in the state remain hard hit. The action taken by this community helped to slow the spread and has allowed us to safely care for patients. We will continue to screen, test, and care for those COVID-19 patients as we have been for the last several months. Please take this positive news as a reminder of the importance of following restrictions and recommendations set forth. As we enter a long weekend, maintain social distancing, wear your mask when in public, and visit our local businesses safely. Here at Altru, we're maintaining our safety protocols and will continue to screen staff and patients, restrict visitors, and require masks. These steps are helping to keep us all safe as we welcome more and more patients in our facilities. It's important that as we celebrate the recovery of many patients, we don't let our guard down. Thanks again for this time today. Have a safe and healthy holiday weekend.
Thank you, Dr. Deere. I want to take a moment to thank Dr. Brenner for his exceptional leadership during this time. The quick transition from in-class instruction to virtual teaching went as smooth as anyone could ask. Drive-through meals for students were made available for pickup shortly after the closure of on-site instruction. The teachers, administrators, students, and parents showed us how tough times can truly bring out the best in us. Grand Forks Public Schools and the entire Grand Forks community should be proud and thankful to have such a great team in place. And we thank Dr. Brenner and all the leaders at the school district for their calm, deliberate, thoughtful, and collaborative approach. Dr. Brenner.
Thank you very much, Mayor Brown, for that introduction, and I'll deflect any of the accolades to all the people I work with, from directors, principals, assistant superintendents, teachers, support staff. That's basically how I was going to start my comments today. This week is the last week of new learning in our distance learning model. Teachers have been busy preparing classrooms for summer shutdown while we're ready to receive curbside technology devices next week. This has been an extraordinary time with extraordinary teachers, students, and parents. My gratitude goes out to the thousands of people who made distance learning an opportunity rather than an alternative. Graduation planning continues with Community High School scheduled for Thursday, May 28th at 7 p.m. in the Community High School parking lot. Central and Red River High Schools are scheduled for Sunday, May 31st, 12 noon for Central High School and 4 p.m. for Red River High School, respectively. As stated last week, there will be a stage for students to cross in cap and gown. Parents will have a front row seat at the stage as their student crosses, and HB Sound and Light will live stream the event. If we have inclement weather, we'll move into the gymnasiums and alter our plans. Summer school for high school will be via distance learning and commences on June 1st and runs through July 7th. Classes are scheduled between 7:45 a.m. and 12:25 p.m. And just a reminder, summer school is both for credit recovery and for acceleration. Elementary and middle school summer school will begin on July 27th in either a distance learning or a face-to-face format, depending on what the COVID data looks like at that time in the summer. And at the Mark Sanford Education Center, we are moving into phase 2 of North Dakota's Smart Restart by bringing back approximately 50% of our staff who have been working remotely. And we'll do this with all the CDC guidelines in place. And finally, I want to reiterate my thanks and appreciation to our entire community for working with the school district on complex issues and decisions during this time. Some may not always agree on the best path forward, but I'm thankful in my role that discourse has been respectful and understanding. At the end of the day, each of us, district personnel, students, and parents, want what is best for our learners during this pandemic. Thank you, and I will stay online for questions at the end.
Thank you, Dr. Brenner. We're also excited to have Wendy Wendt from Grand Forks Public on the panel today to talk about programming and library services amidst this pandemic and their plans moving forward. Wendy's done a great job leading the Grand Forks Public through a number of facility improvements in the last year, and it's terrific to see the enthusiasm the members of this community have for their library. Wendy.
Thank you, Mr. Mayor. I would like to start by thanking our patrons for your ongoing support, flexibility, and digital use of Grand Forks Public as we continue to provide innovative library services while keeping community members and library staff well COVID-19 pandemic. For this health and safety of all, the physical library building remains temporarily closed at this time. In order to ensure that we are fully prepared to serve our patrons going forward, we have developed a draft phased reopening plan and are seeking additional expert input to ensure that we haven't overlooked any potential risks. The library board intends to review the final plan at its June 17th meeting. Our physical building may be closed, but our virtual playground for curious minds is open. If you need a library card to access our online materials, you can request one free through our online website at gflibrary.com. Your card provides access to hundreds of free online resources, including ebooks, audiobooks, e-magazines, online classes, DIY tutorials, ancestry resources, language learning, and much more, available 24/7 from the comfort of your home. We continue to waive late fees and lift holds through July 15th. Book drops also remain closed, and I want to thank everyone for your patience as you hang on to those library materials at this time. We'll be sure to let you know when the drop boxes reopen. In addition to online readers, we're offering virtual programs for children, teens, and adults through our Facebook page. We've offered such programs as children's story times and quick crafts, but also adult programs like Tinker Tuesdays and What You're Reading Wednesdays, and more. They've been very well received, with over 20,000 views combined in April alone. Ebook checkouts are also up by about 1,000 per month over previous months. Most importantly, I want to let everyone know that we will be offering our summer reading program entirely online this year. Grand Forks Public is excited to announce the 2020 virtual summer reading program, Imagine Your Story. This year's program, which starts June 1st, will include digital reading logs for children, teens, and adults. Whether you're 1 or 101, we'll have activities and contests to keep you energized and excited about reading from June 1st through July 31st. You can register for the virtual summer reading program on the library's website beginning June 1st. This year, for the first time ever, there will be a kickoff program sponsored by the State Library from June 1st through the 5th. You can join the entire state of North Dakota on Facebook for storytime, crafts, and STEM activities for all ages from 10 a.m. to 2 p.m. each day. So that's 20 complete hours of programming, June 1st through the 5th. To sum up, on behalf of our entire team and the community of Grand Forks, thank you for your patience. We realize it's not easy to wait for one more of our community's favorite gathering places to open, but we trust that it is the right decision at this time. We look forward to the day when we can safely reunite at GFPL. In the meantime, our biggest priority remains keeping our community safe. We'll be sure to share our reopening plan as soon as it's finalized. And that's
It's going
what I
to be a
have.
busy summer. Thank you, Wendy. And now we'll turn it over to John for the question and answer segment of our virtual news conference.
Thank you, Mayor. Again, to members of the media, please use the hand raise feature so I know to call on you. And we'll get started with Mr. Joe Bowen from the Grand Forks Herald.
Hey there. Terry, I think it was a week or two ago, you made it sound like you guys don't have attendance figures for students who are receiving internet help, which, fine, I guess. Does Grand Forks Public Schools, though, at present, have any way of measuring how well distance learning is working there? And if so, what are those metrics and what are they indicating?
Well, what I do know, Joe, as far as the hotspots that were offered to families in need, the number was between 224 and 244 for internet connectivity. As far as the assessment of distance learning, we know just through research that's happening countrywide that there's going to be slide. There's going to be academic slide from each quartile of our students. We'll have a better handle on assessments as we move into the fall, assuming that we're going to be in more of a traditional face-to-face model where we can use all of the assessments that we have in place where we measure students, particularly at the K-5 level, which is the most important place to look at the literacy and math accomplishments of students. So we'll be using those platforms to assess where students are at. And there's the need for catch-up growth, which I imagine there's going to be for a segment of our population. And that catch-up growth, by the way, when we just look at overall student growth, that can be students. We want to make sure that there's academic growth in all areas. So if we find somebody at the 90th percentile or 95th percentile who didn't make academic growth, we're going to address that. So it's not always just looking at kids who might be behind, but students who should be accelerating as well.
Thank you, Dr. Brenner. Next question is from Neil Carlson from iNews.
Hi, I guess this is for Dr. Deere if Debbie's not around. Maybe a couple things if you don't know the answer. I'm just wondering if you got a numbers breakdown for the mass testing of the 750 or whatever it was last Thursday at the Alara Center. If not, could you maybe speak a little bit about how Altru's doing now? I mean, are you doing elective surgeries and all that? Are things getting back to normal, or it's still a lot slower than average traffic? Or
Yeah, I can comment on the second half of your question, and Debbie's actually on. So from a surgical and elective procedure perspective, we're doing safe practices, and we're starting some testing prior to surgery starting next week. And that's going to only up our capabilities to test and treat everyone safely. We have been doing a quarantine process before. Our volumes are getting near pre-COVID levels in the outpatient setting, and our surgical volumes are slowly coming back. And we expect those to only rise throughout the summer months.
Thank you, Dr. Deere. And we do have Deb Swanson on the line to answer that first part of the question. Deb, go ahead.
Neil, if I understand your question, it was what are the results of the testing that was done on May 14th at the Alara Center? There were 475 individuals that were tested, and all indications are that there were 8 positive tests among residents of Grand Forks County from that event.
Thank you, Deb. Next question is from KNOX.
Question for either Dr. Deere or Deb Swanson regarding the latest testing that is being done around North Dakota. We've been asking for a few weeks now if we could get any input on how many of those or what percentage of those tests are asymptomatic when they take the test. I'm being told today that some people involved in testing are suggesting that numbers as high as 85% of the people that are coming to test are asymptomatic. Can you comment on that percentage?
Let's go first to Deb Swanson. Go ahead, Deb.
Unfortunately, I don't have any data that would support that number that you mentioned. We do know there's asymptomatic spread, and we do know that people that attend our testing events do not have symptoms and test positive. The state health department may be able to provide that, but it will all be dependent on information that's provided by all of the participants when they register for those events or when they are screened by a healthcare provider or in a targeted testing location.
Thank you, Deb. Mr. Joe Bowen.
Hey, this is a question from we got from Facebook here. It sounds like a lot of dental procedures produce an aerosol of some kind, and my understanding is the CDC recommends emergency procedures only. So this person is wondering, is it safe for dental offices to provide non-emergency treatments?
As I'm looking at our panel here, I'm deferring to either Deb Swanson or maybe Dr. Deere if you have any input on that one.
Yeah, I think that they, just like us, are focusing on safe practices. And if they have proper PPE and they're cleaning properly, then obviously our state is allowing them to be open for business, and they're doing just like the medical community is and trying to be as safe as possible for all of their patients.
Thank you, Dr. Deere. Director Swanson, do you have something to add to that as well?
I have a few additional things to comment on that. The Grand Forks Board of Health has a dentist on our Board of Health, and I'd be happy to reach out to him to get more information to advise the caller, the media about that particular question. What I do know is that they have adapted their practices to reduce that aerosolization of particles. They're doing intense screening of patients, and they're doing that screening before they arrive and during the appointment time. And we have been engaged in helping all of them with ensuring that their personal protective equipment fits them properly so they're protected, and they're encouraging their patients to wear masks until the time of their dental appointment, their procedure in the chair. But I'll be happy to get more information about that.
Thank you, Deb. Next question from KNOX.
For Deb Swanson, you and I exchanged emails today regarding the River City Speedway. I wanted to ask you what the position was of the Grand Forks Department of Health on that. Again, the idea was they asked for 900. The word that I had received was that both yourself and the emergency manager were okay with 900, but the county commission was not okay with that. What was the position of the Grand Forks Health Department, the city of Grand Forks, as I have not yet heard back from the emergency manager?
Well, the decision was made by the Grand Forks County Commission. That is correct. We did have a staff member who did review the plan, and they did follow the guidance that's recommended for large events. However, there is no guidance for outdoor special events. So there was a discrepancy between what they intended to offer in terms of their grandstand and what the county commission interpreted the guidance was. The health department didn't have a position, but we did review the plan, and we do know that River City Speedway had put in a lot of effort to ensuring social distancing and a number of other factors that would have made it a safe operation, but it wasn't the health department's position to approve a plan.
Thank you, Deb. Mr. Joe Bowen.
Hey, so this is another question from out and about in the community here. If people are allowed to go to like Walmart, Target, grocery stores, yada, yada, where there's a lot of people kind of filing through pretty regularly, why can't the city or state or whoever hold in-person voting?
The governor's already addressed that, and they've established a mail-in ballot for this election. So I think that's what we're going to proceed with.
But I guess the person's question is, why is it safe to have people going to grocery stores and stuff, but not safe to have them going to polling places?
That's above
Like,
my
is there like
pay
a
grade.
public health reason?
That's above my pay grade. We'll let Deb answer that.
I don't know all the details of voting, but what I do know is that poll workers oftentimes are difficult to find, and oftentimes they are people who might be older or have chronic health conditions. So it really places the poll workers at greater risk to be exposed to such a vast number of people. Having said that, we do consider voting a right, and we want to make it as safe as possible. We also consider going to grocery stores essential. Everybody needs food and they need to shop, but they need to do it as safely as possible. And I believe our businesses have really risen to that challenge and offered opportunities to make it as safe as possible. What I would like to say as a public health professional is it's up to all of us to also make it safe by covering our face, wearing a mask, abiding by the social distancing when we are out and about in the public.
Thank you, Deb. Next question for Mr. Neil Carlson.
I guess one more question for Deb Swanson. Have several viewers that want to know, will there ever be another event or a mass testing event where folks from the community can just come forward and get tested if they want?
That's a really great question. Unfortunately, we don't have a lot of control over large testing events. It's a very delicate balance right now between what the public health data tells us, what the need is in our community, and how things emerge in the community. It's also a delicate dance between the resources that are available at our state lab and the resources available in the community to conduct those. We have done 3 in Grand Forks. There have all been reasons to do them. A significant number of them are now occurring in other parts of our state as well. And we do have a new process now where we can request testing through health departments, through community health centers and other partners. And we are really going to focus on targeting risk groups where there's congregate settings, where there's more likely to be spread. So I think you will see a little bit different approach going forward with testing in our communities.
Thank you, Deb. Next question, Ryan at KNOX. Oh, sorry, Ryan.
We've seen.
There
That's
you
all right.
go.
Dr. Brenner, question. Take 3. Dr. Brenner, question for you. Sorry about that, John. For Dr. Brenner in education, some of the early CDC guidance has come out as far as bringing kids back to school in the fall, and they're recommending masks for anybody over the age of 2. We have, Dr. Michael Osterholm at the University of Minnesota, infectious disease, says that masks don't help. Nonetheless, that seems to be the prevailing attitude. Is it really feasible to have 5, 6, and 7-year-old kids, 4-year-old kids, if they're in preschool, wearing masks all day long?
Well, we'll continue to follow the science and follow the recommendations. I don't know that it would be up to a superintendent's opinion, to make that decision or not. One of the guidelines that we did review today was if people are not within close proximity, in other words, if there's that distance, the recommended distance, people working in offices or kids working not often in isolation, but if they're working in a small group and they're distanced from each other, there would be the opportunity not to have to wear their masks. But we're gonna follow the guidelines and not make up our own rules and try to keep everybody safe, who's under our watch at that time.
Thank you, Dr. Brenner. We got time for 2 more. Mr. Joe Bowen.
Hey, there's another community question. Is Altru doing any sort of antibody testing for the coronavirus? And if so, how does someone get one of those tests, and what's the turnaround for results?
Yeah, Altru currently does have the capability for antibody testing. That said, we're only doing it when it's medically indicated. That would include a pre-op setting, meaning where the result is going to affect potentially our treatment and how we proceed. Currently, insurances are not covering antibody testing. So we are awaiting the state guidance from our North Dakota Department of Health on how we should administer that to the general population. So we're waiting to hear from them before we make a further stance.
Thank you, Dr. Deere. One more question, and Mr. Bowen, it is yours.
So this is another community question from somebody who I guess sells tools hither and yon. They're wondering, is there any sort of restriction, or are there any restrictions, I should say, on essential workers who have delivery routes or job duties generally that take them between multiple counties in North Dakota and Minnesota?
And
Anybody?
I'm looking at Director Swanson here, just trying to rack my brain as far as what Minnesota travel restrictions are. Oh, I'm sorry, Deb. We're hitting the button at the same time.
We're both quick on the mute. And
We are.
unmute.
There you go.
Hey, John. Travel restrictions have been lifted in North Dakota, but what I would say is I really don't have an answer to the question. I'm not really sure I understand it. It sounds like it's a commerce situation, and all rules relative to social distancing and cleanliness and sanitation would apply in this particular situation, if I understand it correctly.
And you are correct, Deb. The travel restrictions in North Dakota, as far as in and out of the state, have been lifted. I was just trying to remember Minnesota's. That's all. Thank you to members of the media. That wraps up our Q&A. And as we have done with these over time, we will end with Mayor Brown.
Well, thank you. Thank you to all our panelists today. So make sure to continue following the guidance from our public health community and doing your part for a GF Smart Restart. Citizens exercising high levels of personal responsibility will be the key to getting back to those things that make this place, Grand Forks, special. This is truly a great community, and we've shown our resilience time and time again. This time will be no different. Stay vigilant, stay cautious, slow the spread, and save lives. We're in this together, we'll get through this together, and together we'll emerge stronger. Thank you, and we'll be back to see you here next Thursday. Thank you, everyone.